2019, a novel coronavirus was detected. That was the start of the COVID-19 pandemic. It sent ripple effects across the world. Ripples we're still feeling today. And it was a challenge for everyone, more so for our frontline healthcare workers and professionals. My name is Ryan Funk with Multicultural. In this series, Together We Can, we sit down with healthcare workers and professionals to hear about their experiences during the COVID-19 pandemic. My guest today is Dr. Denise Koh. Denise, how are you doing today?
I'm really good, thank you.
Thank you. So I guess for the audience, just what do you do?
Okay, well, I'm a public health specialist. I have two roles with the provincial government. One of them is I'm the Chief Occupational Medical Officer for the province, and that's with workplace safety and health. And then the other one is I'm also a medical officer of health with population and public health. I'm also a psychotherapist, hypnotherapist, and life coach, sort of in my spare time. So,
Yes. So when we were first getting that information with COVID-19 coming out, I guess just what were your reactions at the time, and how did that change your work at the time?
I guess my reactions at the time were, fear. I was very fearful, and then when things started to get look pretty bad, I was quite fearful. In my previous role as MOH, a medical officer of health, I was MOH for emergency preparedness and disaster management. So, this is an emergency coming up, and it's not looking so good. So, I had a lot of fear, sort of personally for myself and my family, but then also, what the system could withstand and how prepared we were, and what it could mean for Manitobans. So, it's very scary.
Yeah, I know. A couple years before, we kind of had the Spanish flu. Was that kind of helped give any guidance for how to handle a situation like this?
I guess so. We have pandemic plans that we have every year. We're aware of pandemic plans, but at this level, it was the most the biggest. Most major event, I guess, the biggest disaster, I guess.
Definitely.
How do I say that nicely? Yeah, it wasn't nice, actually. It was a disaster. So it was of that scope. It was quite bad. And, I think in the previous, I was involved, when there was SARS and when there was H1N1.
Yes.
There wasn't a level of fear for myself or my family like there was
for this.
So it's another level. And I think similarly, healthcare providers, physicians, my colleagues, people were scared. And then also being put into situations at work that were even scarier. So it was a lot during a relatively short period of time, actually.
Of course. Well, short, but also felt long at the same time.
You're right. Yeah.
So what did work look like as you were going through, you were in those leadership positions? So, what were you doing during that time?
Well, essentially, I was doing anything related to workers and workplaces and COVID.
Yeah.
So it was kind of everything, really.
Yeah.
So, I was working on guidances, tools, guidelines, for workplaces of different types. And then also a lot of questions that were coming in from employers or, anything related to work, basically, was coming in. And so I was usually involved with those questions too, particularly the non-public facing workplaces. I was also the public health advisor for food processing. So the food processing sector is kind of my baby, I call it. And then also temporary foreign workers. I did a lot of work there with just, arrangements related to that. And then, the high risk workplaces mining camps was a good example, or, the truckers. So there was different most of the different sectors, not so much with healthcare because we had another process for that.
Yes.
But a lot of the other workplaces, that was kind of me. Or I was involved with a lot of that anyway. And then there was also managing the outbreaks too that were happening in the clusters as well.
Yeah.
So it was, kind of anything and
Incredibly
everything.
busy, incredibly hectic period of time.
Yeah, for sure.
So, what was those experiences working with workforces, workplaces? Because when you're listening to the news, not every workplace was enthusiastic. We'll put it that way about some of the rules they had to follow.
Well, I mean, that's sort of, par for the course.
Yeah.
The COMO position is actually with workplace safety and health, which is enforcement.
Yeah.
So we get that sort of reaction from workplaces a lot, or it's not uncommon to have that. A lot of, companies kind of know how we work, and when we work together, things are fine, but there's often that sort of,
Butting of heads.
yeah, a little bit of butting of heads and like not completely sure about what the legislation is, so we have to explain the legislation and the types of powers and authorities that we have in those kinds of situations. So, I mean, yeah, there was a lot of resistance, from some workplaces, but then there were other, workplaces and employers that were excellent to work with. So food processing was, great to work with because they were
It was a very
invested.
smooth system.
Yeah, they were very invested in making sure that infection didn't get into the workplace. So it was really a pleasure to work, with these companies.
Yeah. So when it comes to like the information that we're receiving, as the public, sometimes it would felt that maybe there was conflicting or contradicting things that were coming out. Information was coming really quickly. So for the public, that can feel very stressful and can sometimes feel like there's a lack of guidance. In those leadership positions, when you're around the table, what is that process of you're getting information and then having to relay that in the public? Because you can't share everything.
Yeah, I mean, well, yeah, you're right. There was so much information coming in, and lots of different sources of information. So you have to kind of figure out, the research or data that you want to follow. Sometimes it was also like direction from the rest of the country. So then we'd have to, look at that as well. So it kind of depended on, what the process was. If, if we had other provinces that were kind of doing the same thing, or if the national bodies were doing something similar, then we had to, generally fall in step with that, or we tried to be as consistent as we could be. But a lot of times it was, new issues that came up that, there was no precedent for it. So then we have to kind of make up what we're going to do. Like we have to figure it out and kind of, do risk assessments and then, try things. And if that doesn't work, then do something different. So it was very much like hands-on and really, watching things constantly, reassessing to see whether things were working and, whether they weren't.
Yeah. And I guess another challenge is trying to get ahead of misinformation, because the internet was, what a time on the internet during those past couple of years. Like ivermectin treatments. I can't even I can't even say it.
Oh, hydrochloroquine, yeah.
Yeah. So what is that process? Trying to like get ahead of the internet at times.
I don't think it's possible to get ahead in a lot of ways. Like there were a lot of things that just kind of like these weird conspiracy theories that kind of came out, and it's like, what do we do with this?
Yeah.
So oftentimes we weren't able to get ahead of it. And I think that was one of the challenges that we faced, was there was constant, resistance, and it was very difficult to sort of battle that misinformation. And, and it was also very distressing too, because like, especially, what was going on in hospitals and, in clinics and like clinical settings, people were getting very, upset and were increasing risk for different things. So there was just so many things to think about. It was a very emotional time as well.
Of course.
And very, distressing to hear about some of these things or to see some of these things happen.
Yeah.
And, kind of human nature. I sort of get it, but then it was also very frustrating as well.
Well, yeah, especially like for our healthcare workers and individuals who were like risking their lives at time to be on the front line to treat people who are sick, and then you have this subsect of the population that's kind of treating individuals with disdain at times.
Oh, and it went to sometimes abusive behavior as well. Like there were people that were attacking, healthcare workers and, some of my friends and colleagues and things like that. Sometimes it was, verbal abuse or whatnot. And I think a lot of people were scared. So I kind of understand from that point of view. But then I'm also seeing the effects of it on, people I really care about and, how frustrating that is or that was to address or to deal with.
It can be very hard to have a collaborative approach when there is aggression.
Oh yeah, for sure. It's I mean, we do the best we can in those situations. But yeah, we're not gonna put ourselves into a risky situation, or we try to sort of protect, ourselves as much as possible, just so that we can do more and have more impact, going forward. But sometimes these things, you can't predict or prevent fully. So.
So during this period of time, you were incredibly busy. Not really a 9 to 5 clock off. I'll get to it tomorrow sort of situation. Just to let the audience know, like, what sort of toll does that take on individuals in leadership, both physically and mentally, when you're just you're on the clock almost all the time?
Well, I'd say physically, it was very difficult. It was very stressful. My workload increased quite a lot. I was basically, working every day, well into the evenings, and generally being on call for pretty much the majority of the pandemic, just because of the nature of the work that I was doing. So that part was incredibly stressful. And, when I look back at it, yeah, I didn't, a lot of times I didn't leave the room. I was working, I was at my computer. I, run, grab some food, come back, have meals at my computer. So I missed a lot of, dinners and activities with my kids, my family. Yeah, so that part was very stressful. Yeah, there were some days where I hadn't left the house at all. So, yeah, it was a lot. But I guess the other piece of it, mentally, there was the stress of the situation, but there was also, sort of interestingly for me, I got a lot of satisfaction out of the work. Yeah. So I'm generally, I like working in fast-paced environments where I can actually see the change.
Yeah, you're a go sort of
kind of
person.
A go, but also like, if I do something or implement something and then I see the result, that's satisfying to me, that I see that. And oftentimes in public health, you don't see things until like way later down the line, or if at all. You just kind of have to trust that things are happening, you're doing a good thing, right? So that piece of it I actually really enjoyed. Even though I was, working so much, I also really liked what I was doing. I really enjoyed the work. I enjoyed the people that I was working with. I liked the impacts that I was able to make for some of those decisions, et cetera. So that part was actually good. There were lots of distressing things as well there. It was very stressful. The information coming constantly kind of meant we had to be on all the time.
Yeah.
So it does take a toll. Right. So yeah.
How are you doing now? How are you feeling now as things have kind of calmed down a little bit?
I think I'm doing pretty good, actually. I kind of look back at the pandemic, and it just amazes me how it seems very much like how it was pre-pandemic. Yeah. And we had this big major thing that happened for whatever 2-3 years. Well, it's still kind of we still have cases, et cetera. So this chunk of time, and things were so vastly different. It's weird to kind of be in this state right now and kind of still kind of trust that things are okay.
We're adjusting the grounds a little. You're like, okay, well, I think I found my balance.
Exactly.
So now that we've come out on the other side, what do you think we can learn from the whole pandemic? Like our reaction, our systems in place. What can we learn from everything looking forward?
I think there's lots of things that we can learn from this. I mean, I think there's lots of things that we as a province did that was really quite excellent and great. For my unit in particular, we worked really well with the stakeholders, and we really worked well as a team. And I know that overall, there was a lot, like, people were putting in the time, so they were working extra hard, they were putting extra hours. So I mean, that piece of it was really quite great. I think there's a couple of things. One of them, I guess, would be, how we collect information.
Yeah.
So, and the reason I'm pinpointing that is because how we collected information, or when we did or we didn't, that affects the policies that come out of that. So if you're not measuring something, then it's really hard to justify putting something into place, even though, there might be a really strong reason to do that, or to put in those policies. So that's something that I think, especially when it comes to like anything related to occupational health or worker health. So we weren't really collecting, workplace or occupation on all of the cases, for instance. So then it made it really hard to look for trends that are happening in sectors.
Yeah.
So that's just an example where, that's something like looking at the data that we were collecting. We also were measuring the race, ethnicity, indigeneity of the cases that we were, getting. So that was actually very good information to get, to be able to, measure what was happening in the different racialized groups.
Yeah.
So I think there's something that we can learn there. One of the things is that in terms of when we were doing the eligibility criteria for the vaccine, we went with an age-based approach.
Yeah.
We meaning the province. And that was something that I really noted early on, was that a lot of the cases we were seeing were, especially in workers, were racialized. So there was a piece of that too. And so, I was really pushing for looking at other ways to determine eligibility, and not just based on race.
Yeah.
Or not just based on age. So for instance, if we did look at race a little bit more, I think that would have, made a huge impact. And that's something that, I think our stats really showed that it probably would have done something, or would have, lessened the negative impact of the pandemic.
So conversations to be had.
Yeah. And then I think also just the communication. So communication amongst ourselves as a body,
Yes.
The different departments, I think that could have definitely been improved, because there was a lot of duplication of efforts. There's people doing some things that are different from here. It wasn't totally consistent. That's natural, for that to happen, but it could have been better.
So streamlining kind of like the
streamlining the
chain.
communication. And then I think the other piece of it too was really strengthening our relationships with the public and the different communities, because you could really see, especially with the misinformation and the conspiracy theories, et cetera, where there was a disconnect between what we were trying to say, like, this is what the research is showing, and maybe there was a lack of trust in a lot of cases with what we had to gain from recommending it. And it's like, there's nothing we're gaining other than you being alive, and it being really, really difficult to manage if you're not alive, or if you're spreading it to other people. So like getting that kind of information out and dealing with that, if we had maybe had better relationships with the public and with the different communities, maybe that would have been less of a factor, I guess.
Thank you so much, Denise, for taking the time to share your perspective with us. A lot of people aren't thinking about, what was leadership going through, what was the thought process during that period of time. So thank you.
You're welcome. It was a pleasure to be here.
I'm Ryan Funk with You Multicultural. This was Together We Can. Thank you for watching.